can, one of the things that I love is that having seen all the different videos, you can really see implementing what we talked about before and the areas that you wanted to improve, you immediately put it into practice, which I think is great. So
Thank you.
yes, I'm very excited about that.
I want to say about the improvement. For next time, I need to like maybe stand up and walk around the kids a little bit at the corner. Because when I start to edit my video, I notice there's a Xiaoyi and Max, they were not paying attention. But sometimes when I was like on the one-on-one time with the assessment, I didn't notice them like until now. So next time I maybe will like stand up so that I can keep talking without stopping my teaching. So we'll know teachers around me. And the second one, I think I kind of ring the bell too many times. So next time I will try to have a like a meaningful pause or just to give them a look. And so they will know they need to refocus on me without like stop teaching. For some kids, they're still paying attention and I just stopped. I think it's kind of not good for them.
That's good. Yeah, I mean, I think for children, if they see you sort of transition into movement, that'll immediately get their attention. But also remember that since it's a team, you can always count on your other teacher also, walking around if you're in the middle of a lesson. So that's something, that you can collaborate. But I think it's a really good idea for you to stand up and move. I mean, I think that's a good way to get their attention. So yeah.
And for this class, we have standard 4 and 5. So it's for students apply our content to the real world experience. So we had that role play. Did you see? It's so cute that they have, one doctor, one nurse, and one patient. So they're really active. They keep adding up more symptoms and test the doctor. And also we have many assessments. I said the souvenir thing is a good idea. So I do like a blind box. So they need to pick it up and tell me what it is. And that was good. And also, I give them like more visuals. Now this is my third lesson, so we kind of have a routine. They know what to do. The calendar, the weather, and then the emotion. And then we add more emotion in it for this class. And then we add 2 more Chinese character numbers. And so it all went, kind of good. It's just to have so many transitions or like to get their attention.
But you know what? I think, you also might be a little self-conscious about that. I didn't think it was bad. I thought, because I feel like the students are already sort of used to what the sound is going to be. And so it helps them really bring them back in focus.
Yeah, they listen. They would
and it's combined with movement, with putting their hand on their head. So that's good. But I really love it. I wanted to ask you, I thought it was really successful when you had them do the role play with all the props, the stethoscope and the injection. What was it that you said to them what instructions that you give them right before them doing that? Because I feel like they immediately knew what they had to do and they were like interactive and engaged. So what did you tell them?
We had kind of like a practice morning. Some kids was coming here early, doctor kid, the classroom toy. So they can play in the morning. I see them playing. I'm kind of telling them as a doctor, you need to do what? This time I need to tell the whole class how to do it. And then they have limited Chinese saying. So when I whisper to them, I tell them the keywords, like how to say the thermometer. I say, you need to say 温度计. Then the doctor asks the nurse, pass me the thermometer and stuff.
Right, that's good. But you're supporting the students that need more help with the content and the vocabulary. You're supporting them by giving them that sort of scaffolding. So that's really good. I was really amazed by the fact that, and now I understand, because you gave them the preparation before the circle, which I thought, I think is really good. They really responded well to the instructions that you gave them. They like right away caught on that they were taking their learning and putting it into, like a role play, a dramatization of what you were saying. And, I think it was hard to obviously hear for me in Mandarin because, even though you said the words, but I feel like they were using the vocabulary.
Yeah, they were.
But, I thought that was really good. And then how did you feel you did with just connecting it to their experience, like their real world experience? I feel like you did that.
Yes, we also talk about other thing. We have a small book, and we were talking about if a person is really sick, you have no help, but you need to go to the hospital, and I tell them you need to call 911 for the emergency. And also for us as children, how do we stay healthy? And we went through like eat healthy food and wash your hand and exercise and sleep. They all say that in Chinese. So now lunchtime, nap time, I will tell them you need to nap, you need to eat, so you don't be sick. So that kind of helps.
So it's almost like you're making sort of the cohesive environment, like the whole day you are bringing in the concepts and the vocabulary. No matter what part of the day you're bringing it into them, which I think is, is a great way to make sure they're getting the content. And it gives you the opportunity to assess who is understanding and who needs more help.
Yeah.
I saw the differentiation. I saw how you were communicating with the students that were ELL.
Yeah.
I think you're making the lesson inclusive for them and make them feel comfortable, but at the same time, you're challenging them because they still have to respond. You're just giving them
Right.
options of how to respond.
Yeah.
So that was really great.
Also have like more harder vocabularies for the advanced students. We have all the tools for them to learn, and I think they can pick up a few, and the next time when we review, they can learn more. Yeah. So what no, it's not too easy. There's always a lot to learn. Yeah.
Right, exactly. And I think that's one of the key things that you're really performing amazingly is you're able to take the same lesson, but the way that you interact with each child is tailored to how much they can do and how well they can do it and what
try.
supports they need.
Yeah.
No, I mean, it's really, I think in a way it's an advantage that I don't know Mandarin because it makes me sort of work harder when I'm looking at you. And I can tell by the child's reaction and by the way that you sort of like either push harder or take a step back, like you can really tell that each child is at their comfort zone,
Oh,
but you're still assessing their knowledge and you're still getting thumbs up. I loved when you had the students that can't write yet, that you had them do it in the air. Like, I think that's a really good differentiation tool. But then you had the more advanced student writing the number on the board. So that was great.
thank you.
Especially 'cause at this age, I feel like the levels are so different,
Think they can start to be familiar with shapes and remember how it looked like. So that's why I have them to practice to do the writing. But they don't have to be very perfect at this age. Yeah.
Exactly. Yeah. That's
Yeah.
really good. And then you're giving, those students that are more advanced, you're giving them opportunities to be leaders and to model the behaviors, and the knowledge. So I think it's really good. I think it went really well again. So
Oh, thank you.
yeah.
Yeah.
So keep it going.
I will.